Warahmatullahi wabarakatuh. Best wishes for all us, their father, mother, and brothers and sisters. Currently, 209 countries in the world, including our country, Indonesia, are facing challenges that were never imagined before. A tough time for our life, even this corona pandemic has brought sadness to some people and difficulties to many. And we all experience minor change in our daily lives. On this occasions, I would like to express my high appreciation and gratitude to all doctors, all nurses, and all medical personnel who have fought on the front lines and continue to fight until now, and those who have played an important role selflessly. TNI, Polri, volunteers who carried out tasks outside the home for all of us. On behalf of the community and the country, I give the highest appreciation for what Mr., Mrs. and brother have done. Do do is tremendous sacrifice. I also want to thank Mr. and Mrs. and brother and sister who have stayed at home, because by staying at home we have all tried to break chains of spreading COVID-19 virus, and the means it has saved many families from this virus. Let's continue to deal with this pandemic, together work, together unite, because only through this togetherness will we be able to overcome it. We are not alone, we are together with other countries who are also experiencing the same thing, to overcome this pandemic together. And stay patient, optimistic, and disciplined at home. Keep your distance in dealing and interacting with other people. Avoid crowds. Wash your hands diligently. Wear a mask when leaving the house. When we practice that strong discipline, God willing, we will return to normal situation and condition, and be able to meet relatives, meet friends, meet relative and neighbor in normal situation. But for now, let's just stay away from home. Just stay at home. What to do to keep yourself and others safe from COVID-19? Maintain at least 1 meter distance between yourself and others to reduce your risk infection. When they cough, sneeze, or speak, maintain an even greater distance between yourself and others when indoors. The further away, the better. Make wearing a mask a normal part of being around the other people. The appropriate use, storage, and cleaning or disposal are essential to make masks as effective as possible. Here are the basics of how to wear a mask. Clean your hand before you put your mask on, as well as before and after you take it off, and after you touch it at any time. Make sure it covers both your nose, mouth, and chin. When you take off a mask, store it in a clean plastic bag, and every day either wash it if it's fabric mask, or dispose of a medical mask in a trash bin. Don't use masks with valves. How to make your environment safer? How to make your environment safer? Avoid the three C's: space that are close, crowded, or involve close contact. Outbreak have been reported in restaurants, practice, fitness classes, nightclubs, office, and places who offer worship, where people have gathered, often in crowded indoor settings where they talk loudly, shout, breathe heavily, or sing. The risks of getting COVID-19 are higher in crowded and inadequate ventilated space, where infected people spend long periods of time together in close proximity. These environments are where the virus appears to spread by respiratory droplets or aerosols more efficiently, so taking precaution is even more important. Meet people outside. Outdoor gatherings are safer than indoor ones, particularly if indoor spaces are small and without outdoor air coming in. For more information on how to hold events like family gathering, children football games, and occasion, read our Q&A on small public gatherings. Avoid crowded or indoor setting, but if you can, then take precaution. Open the window, increase the amount of natural ventilation when indoor. WHO WHO has published Q&As on ventilation and air conditioning for both the general public and people who manage public space and building mask. Wear a mask. Don't forget the basic of good hygiene. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. This eliminates germs including virus that may be on your hands. Avoid touching your eyes, nose, and mouth. Hands touch many surfaces and can pick viruses. Uncontaminated hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and infect you. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately into a closed bin and wash your hands by following good respiratory hygiene. You protect the people around you from viruses which cause colds, flu, and COVID-19. Clean and disinfect surfaces frequently, especially those which are regularly touched, such as handles, facades, and phone screens. What to do if you feel unwell? Now, the full range of symptoms of COVID-19. The most common symptoms of COVID-19 are fever, dry cough, and tiredness. Other symptoms that are less common and may affect some patients include loss of taste or smell, itches and pain, headache, sore throat, nasal congestion, red eyes, diarrhea, or a skin rash. Stay home and self-isolate even you have minor symptoms such as cough, headache, mild fever until you recover. Call your healthcare provider or hotline for advice. Have someone you bring supplies if you need leave your house or have someone near you. Wear a medical mask to avoid infecting others. If you have fever, cough, and difficulty breathing, seek medical attention immediately. Call by telephone first if you can and follow the direction of your local health authority. Keep up to date on the latest information of trust such as WHO or your local and national health authorities. Local and national authorities and public health units are best placed to advise on what people in your area should be doing to protect themselves. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.